In this video, we will be discussing haemorrhagic septicemia. Haemorrhagic septicemia is a bacterial disease which caused by Pasteurella multifida. There is another similar disease to that of hemorrhagic septicemia that is pneumonic pasteurellosis in cattle. That pneumonic pasteurellosis is caused by a different etiological agent. That's name is Pasteurella hemolytica. So the idea of saying these two diseases are different because there is still many confusions regarding the hemorrhagic septicemia and pneumonic pasteurellosis in cattle. Many of the veterinary community feels that both the diseases are one and same, and even in the literatures and even in the lectures, they will be delivering as a pasteurellosis. They will be combining hemorrhagic septicemia and pneumonic pasteurellosis as one disease called as pasteurellosis. So we need to keep in mind that these two diseases are different disease and they will be caused by different etiological factors. On this note, let us start hemorrhagic septicemia. It is commonly called as transport fever, stockyard disease, and Barbon disease, and Galagantu in Hindi. As you all know, Galagantu means any tumor-like growth or swelling at the neck. Gantu, it is a tumor, and Galagantu is the area beneath the neck region. So what happens means in this disease there will be accumulation of the fluid edema at the ventral aspect of the neck. So we specifically call it as brisket region. In that region there will be accumulation of fluid and swelling is there. So because of that it is called as Galagantu. And the stockyard disease is because the main pathogenesis of this stockyard disease is because of the stress factor. So whenever the animals are crowded in the stock, so that might lead to the stress condition in the animals, leading to the upper hand of the etiological agent present in the body before the onset of the disease. Now transport and the shipping, the concept is same. During these two things there might be an elevation of stress on the animal, leading to the hemorrhagic septicemia. Now let us try to define this disease. It is an acute, highly fatal disease which is characterized by acute septicemia. Septicemia is nothing but presence of microorganisms more than the what we will encounter in a daily day-to-day life. There will be bacteria present in our blood circulation, and that bacteria are be countered by our body immunity. Whenever there is a condition in which the multiplication of the bacteria upper hand or overtake the immunity of the host, thereby leading to suppression of the immune host, and pathogenesis of the disease will start. And such state of diseases we called as septicemic diseases. To define it as septicemic is nothing but the state of the body in which there is increased multiplication of the bacterial agents, leading to the suppression of the immunity of the host, and there will be hyperthermia and release of toxins by the bacterial agent, and high fever, swelling at the ventral aspect of the throat, neck, and brisket, causing dyspnea. Now, etiological agent is Pasteurella multifida, type 1 or B. It is gram negative. So these organisms are known as bipolar organisms. Whenever we will stain these organisms, we will encounter at the end of these organism there will be uptake of stain, and between those two extremities there will be no stain uptake. So it look like a bipolar organism. Now, when it comes to host ranges, buffaloes are more susceptible rather as compared to cattle, pig, horse, sheep, and goat. And maximum occurrence is noticed during the monsoon season, because during the onset of monsoon there will be drastic change in the climatical conditions. So animal which are already adapted to that climate, they have to transfer themselves towards adoption of the other climatic condition. So during that situation animal will undergo a severe stress. That is the main reason of the upper hand of these etiological agent producing the diseases. Now, precipitating factors like stress, it may be because of transportation, heavy warmth load in the GIT, and starvation, and viral infections like IBR, parainfluenza. In these factors can precipitate the disease HS, that is hemorrhagic septicemia. Now let us look at how this disease will transmitted between the cattle to cattle and buffalo to buffalo from animal to animal. It may be from ingestion of contaminated feed and water through inhalation of the etiological agent. The initial site of proliferation thought to be in the tonsillar region, and the source of infective bacteria is thought to be the nasopharynx and the nasopharynx of the bovine carriers. These organisms, the Pasteurella multisoda, is naturally inhibitant of the animal, which is present in the nasopharynx and tonsillar regions. Whenever you will be, it might encounter that just taking the tonsil and nasopharynx secretions and staining it, we may encounter the Pasteurella um, multicellular organisms, but it is not like that the animal is suffered with the HS disease, because these organisms are naturally inhibitant of the tonsils and nasopharynx. Whenever there will be a stress factor and the immunity of the animal gets down, in that condition the multiplication of the bacterial agents will be overloaded, and they will start producing toxins, and those toxins will elevate the temperature and initiate the pathogenesis in the host. So this is the mechanism behind the pathogenesis of the organism. Stress is the main factor for the hemorrhagic septicemia. Now let us look at the pathogenesis. The organisms from the environment enter into the terminal bronchioles and alveoli, or sometimes the organisms are already present in the animal itself. They will enter in the bronchioles and alveoli. They cause changes in the lungs in the presence of predisposing factors like the stress factors. These are the main predisposing factors, and they cause the changes in the lungs in presence of the predisposing factors. And there they destroy the leukocytes and macrophages. Thereby they are doing that, they are countering or reducing the immunity of the host cells, and then they release histamines and VEGF2 alpha. These are the inflammatory cells and leading to inflammatory conditions, and sometimes fibroblastic elements that may ultimately lead to septicemic changes in the body and inflammatory changes in lung parenchyma. So they produce pneumonia with the help of secondary invaders like parainfluenza, bovine herpes virus, and other bacteria. And because of pneumonia, there will be difficult for the respiration, and so animal will severe pressure on the respiratory system. Ultimately, death is due to asphyxia. Now, let us look at clinical findings. There will be high fever and profuse salivation, petachy and the mucosa, and edematous swelling under the throat, neck, and brisket region. This is the clinical pathognomic finding. And swelling are initially they are hot and painful to touch, and increased respiration will be there because there will be pressure from the brisket edema and the swelling of the neck region. The pressure puts on the lungs, so the respiratory efficient will get reduced. To counter that, initially body will try to compensate that pressure on the lungs by increasing respiration, and there will be grunting sounds and followed by dyspnea and death. Then how to diagnose this disease based on clinical findings like swelling, edematous swelling at the region of ventral to neck and brisket region, and increased respiration and grunting sounds will be there. Uh, then seasonal occurrence makes the tentative diagnosis, like during transition of the entry of the monsoons and any severe drastic stressful climatical conditions, this disease will outbreak. And by microscopic examination of the secretions of the tonsillar and nasopharynx, and we can check through nasal swab, we can identify the bipolar organism Pasteurella multisoda, and animal inoculation and serological tests like CFT, complement fixation test, and other tests we can use for the diagnosis. Now let us come to the treatment of the disease. Like various sulfonamides can be used, like 130 to 150 mg per kg body weight for 3 to 5 days, and tetracyclines, penicillins, chloramphenicals are effective if treated early. In the starting itself, we defined it as the acute fatal disease. If the treatment get delayed, or the disease will not get appropriate attention from the veterinarian, then he might or she might lose the case. Then anti-inflammatory and antihistamines and supportive therapy can be given. And like in case of preventive and control measures, there will be a vaccine, and three kind of vaccines are widely used: a plain vaccine, HS broth vaccine, and alum type precipitated vaccine and oil adjuvant vaccine. The most effective bacterium is the soil adjuvant. One dose provides protection for 9 to 12 months. It should be administered annually before the onset of monsoon. This is about the disease haemorrhagic septicemia. To sum up this disease, there will be clinical signs like swelling at the throat, neck, and brisket region, and there will be increased respiration and grunting sounds followed by dyspnea and death. It is an acute disease. Pathogenesis is very simple. Whenever there will be stressful condition experienced by the animal, the organisms which are naturally present in the tonsillar and nasopharynx region, the multiplication get increased manifoldly and leading to production of toxins and the pathogenic inflammatory cells like histamines and PGF2 alpha. They will leading to inflammatory and mnemonic changes because of the secondary invaders like parainfluenza and bovine herpes virus, and they will the etiological agent get transmitted through ingestion or inhalation, and it is an acute highly fatal disease of Pasteurella multisada, in which there will be septicemia and high fever, swelling at the ventral aspect of the throat, and it is an bipolar organisms. And host range is mainly noticed in case of buffalo and during monsoon. From BID's point of view, we have to remember during monsoon, buffalo, Pasteurella multisada type 1, and septemic disease. Stress is the main causes of the pasteurellosis. So, in the next video, we will discuss some other disease, some other bacterial disease. Until then, thank you and bye.